afternoon. I'm Ida Ramos, Deputy Director for Pima County Justice Services. I work at the intersect of public safety, health, and social issues. I'm also a mom, a daughter, a sister, and a lifelong Southern Arizona resident. And I have a question for you all this morning. Have you ever had to call 911 during a medical emergency? I did. My mother suffered a deep vein pulmonary thrombosis. A blood clot traveled through her lungs and obstructed the blood flow. Second question. When on an ambulance, have you ever had to think 911 transport to where? I did, but I'm not alone in that. Hundreds of Southern Arizona rural residents have to ask themselves that. In fact, 100% of residents in Santa Cruz County, when seeking any sort of medical care or specialty care, have to ask themselves that. Santa Cruz County has one hospital, car ambulant, Holy Cross. With limited services, what exactly do I mean by limited services that lead to lack of access? Limited services to specialty care, cardiac units, orthopedic services, endocrinology, and oncology services. Those are all categorized under specialty care that a lot of our rural communities do not have access to or have very limited access to. Remember my mom and her pulmonary thrombosis? Well, according to the CDC, one of the factors most contributing to mortality rates is adequate and immediate access to treatment, what is commonly known as the golden hour, 60 minutes. Travel time between downtown Nogales and the closest hospital, which is Tucson. Tucson is our specialty care hub, is 64 minutes. 60 minutes is the golden standard, but travel time is 64 minutes. In addition, Santa Cruz County is designated as a healthcare professional shortage area, according to the Health Services and Resources Administration. So what does that mean? Per capita, we do not have enough health service providers. So in closing, I want to share. Southern Arizona rural communities are strong, but do they have to be resilient in order to obtain access to care and risk their lives to do such? My ask is that we need targeted investments to improve the infrastructure and enhance retainage of the workforce in order to save lives for Southern Arizona.